What if the doctors saving lives across the world were not truly free? For decades, thousands of Cuban doctors have traveled to countries in Africa, the Caribbean, and Latin America, treating the poor, fighting epidemics, and becoming heroes in communities that desperately needed them. But behind the white coats, critics say there is a hidden system. A system where doctors surrender most of their salary, where their passports can be taken, and where leaving the program could mean never seeing their families again. This is the controversial story of Cuba's global medical missions. For over 5 decades, thousands of doctors from Cuba traveled across the world to heal the sick. They worked in remote villages, crowded hospitals, and struggling nations. One of the countries they helped was Jamaica. To many patients, they were heroes. But behind the humanitarian mission, there was a hidden story few people knew. A story about politics, control, and a system some critics now call modern-day servitude. After the revolution led by Fidel Castro in 1959, Cuba created a global program sending doctors abroad. The idea was simple but powerful. Instead of exporting soldiers, Cuba would export medical help. Over the decades, Cuban doctors were sent to more than 60 countries across Africa, Latin America, and the Caribbean, and Jamaica became one of the countries that welcomed them. For many years, Jamaica struggled with shortages of medical professionals, especially in rural hospitals and clinics. The arrival of Cuban medical teams helped fill that gap. Doctors from Cuba worked long hours in emergency rooms, maternity wards, and community clinics. They treated thousands of Jamaican patients and helped strengthen the healthcare system. Many Jamaicans remember the Spanish-speaking doctors who showed compassion in moments of fear and illness. But while the doctors were saving lives abroad, their own freedom was often restricted. The international medical program was controlled directly by the Cuban government. Doctors did not negotiate their own contracts with the host countries. Instead, governments such as Jamaica paid Cuba, not the doctors themselves. According to critics and human rights advocates, a large portion of the doctors' salaries was kept by the Cuban state. Some reports suggest doctors received only a fraction of the money paid for their services. Former participants in investigations have also described strict rules governing the doctors' lives abroad. These included passports often held by supervisors, restrictions on travel, monitoring of their movements, limits on bringing family members, severe penalties if they left the program. Some doctors who defected from the program later described the conditions as coercive. Documents and testimonies referenced by researchers and collections sometimes described as the Cuban archives have been cited in debates about the program's structure and control. Because of these restrictions, critics, including some international organizations, have argued the program resembles forced labor or modern-day servitude. Supporters of the program, however, say it provides valuable income for Cuba's healthcare system and allows doctors to earn more than they would at home. In recent years, Jamaica's government began discussing reforms to make the arrangement more transparent and humane. Prime Minister Andrew Holness and his administration sought to renegotiate aspects of the agreement governing Cuban medical workers in Jamaica. The goal was to ensure the doctors working in Jamaica had fairer compensation and clearer labor protections. However, negotiations reportedly faced difficulties. The Cuban government rejected changes that would alter the structure of its international medical program. The disagreement raised questions about the future of the long-standing partnership. For many Jamaicans, Cuban doctors will always be remembered for the lives they saved. Children were delivered safely. Patients were treated in hospitals that once lacked enough physicians. But behind the compassion shown in hospital rooms was another reality. A system controlled by governments, shaped by politics, and debated across the world. Were the Cuban medical missions an extraordinary act of international solidarity, or were the doctors themselves trapped inside a system they could not fully control? The answer may depend on who you ask. But one thing is certain, the story of the Cuban doctors in Jamaica is not just a medical story. It is a story about power, sacrifice, and the complicated choices faced by those who serve far from home. History often celebrates the people who save lives, but sometimes the real story lies in the system behind them. And and the story of the Cuban doctors may be one of the most complex humanitarian missions the modern world has ever seen. If you enjoy powerful stories about global politics, hidden history, and real human struggles, make sure to subscribe to World Stories, because the next story might reveal another truth the world rarely talks about.